Hi, everybody. This is Dr. Kerry Makin-Byrd. I'm a clinical psychologist and executive coach working with leaders. And this is the inaugural video series on my blog and maybe YouTube, where I am interviewing some of my very, very favorite therapists in the world, the ones that I refer, Hope is laughing at me, that I refer my good friends to. And I wanted to just give these amazing local therapists a forum so you could get a chance to see them and hear them and learn some things about what they do as well. So Hope, do you mind introducing yourself and giving everybody a little orientation to what you do?
Sure. So I am a clinical social worker, and my background and training is in something called radically open dialectical behavior therapy. And if you didn't know, there's two kinds of DBT. So radically open dialectical behavior therapies for disorders of overcontrol, which basically means people that tend to be lean perfectionistic, rigid, rule-governed behavior, tend to work really hard, maybe don't know how to relax very much, and they are also sort of looking to be able to connect, and a lot of people feel lonely at times. And so they might be really great at their job and then kind of clueless about social life, or you might have had some sort of event in your life and you kind of, I don't want to say fell off the wagon in like the alcoholic sense, but more like in the life sense, and that they're struggling to maybe return to their tribe. So I work with people that need help with that.
Oh, awesome.
Yeah.
And Hope, one of the things that I feel I have loved following you on Instagram is the way that you in these very down to earth, real world, not therapy speak ways, talk about if this is an experience you have, maybe radically open is for you. So do you mind sharing a couple of those kind of, if this is your experience, maybe radically open is a good fit?
Yeah, so I do like a series of kind of, I think you're referring to some of the funnier stuff that I post, like, you know, one of the skills in radically open DBT is to learn to laugh, to joke, to have a good time. And sometimes we do these quirky habits, like, you know, if you're someone who reorganizes a dishwasher after someone's already loaded it, you might be over controlled. So I do some funny ones like that. And then some more serious ones like, you know, kindness. Like, if you don't know what else to do, be kind. And if sometimes that's a struggle, then you might be over controlled. And a lot of times the tendency is like to problem solve or work really, really hard. And sometimes we just need to learn to chill out and relax and like look at the flowers, kind of smell them.
Yeah, right. What are you in this season of great economic uncertainty, pandemic uncertainty, in the midst of what may be a real social revolution around systematic racism? What do you think are some of the most powerful or useful radically open skills that either you see people implementing, or it would be useful if they implement, or even you are finding useful in your own life?
That's a great question. The first thing that does come to mind is what I said about kindness. Like, if you don't know what to do in a situation, be a kind person. And kindness isn't always like, you know, being a pushover, being compassionate. Sometimes it's standing up for our beliefs, but doing it in a way that is allowing people to hear us, not bulldozing, and sort of just being present for other people. Another skill that I think is really important is based on the idea of psychological health, which is a flexible response. So if I go into a situation and I think I'm going to act one way and something changes, am I able to adapt to that situation? And so obviously with COVID happening, with some of the protests that are going on and continue to go on, and some of the political change that we might be seeing, one of the things is like, can I respond flexibly to this, whether I like it or not? And am I able to then take new information in, so disconfirming feedback is what we call it, and then adjust myself to what's going on, which is a really important skill in Radically Open. It's like, am I open enough to hear something that might be hard for me to hear and then assess it? Because I don't always have to take the feedback, but I might just like want to assess it and see if it has some truth to it for myself.
Oh, love. Thank you.
Yeah.
In my own work, I talk a lot about we get to decide whether, if reality is a rock, we get to decide if we want to be another rock or if we want to be the water.
Yeah.
And the water wins, right? The water, I mean, to be clear, my goal in therapy is not for us to win all the time, but it is for us to show up flexibly and learn. And that's such a beautiful, thank you for kind of laying that out. That's beautiful.
Yeah. There's a great mantra that Dr. Lynch, the treatment developer, says, just because you think it doesn't make it true.
Oh, totally. And I think sometimes for the kind of flexibility piece, definitely a joke at my house is that one of my responses is, it depends. It always depends, right? And I think it's a little kind of cliche therapist language, like, well, it depends.
Yeah.
But it is a reflection of the nuance and flexibility of coming to a situation and reading realistically, even like I'm trying to think about my own values, consistent behavior. I don't have a script for what parenting looks like each morning. I have some idea, right? I have like values and priorities and North Stars, but when I'm at my best, I'm being pretty flexible to what her hangry level is, what my level is, and the other realities of the day.
Yeah. Yeah. Within reason, right? You know, there's routine within reason. And then there's, you know, oh my gosh, I am not feeling well this morning. And how am I going to adjust to that?
Yeah, absolutely.
Yeah. I think that's a wonderful thing.
Hope, what advice would you give to people who are beginning their search for a therapist?
Oh, wow. I think probably the number one thing is figuring out what it is that you want to get from therapy. So if I, if I go to a therapist and, you know, maybe I feel like I want to work on some depression issues or anxiety issues, to be really clear about what those issues are that I want to work on. And then secondly, if I go to a therapist and it's not a good fit, go to another one.
Yes.
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 Flexible responding.
Yes.
Sometimes a fit in therapy, particularly with that therapist, is just so incredibly important, because you're going to maybe be with them for a little bit of time. You know, and particularly in my therapy, it's a 30 lesson treatment. So you're going to be with me a while. If you don't like me, or if you don't get along with me, or you think I'm a wacko, then you should probably maybe find someone else. And that's okay. Like, I'm happy to refer out and not be the end all be all for someone. Yeah. And then also, I think if you go to a therapist and you ask them what kind of therapy they do and they don't know, that might be a red flag. Or if they say something like very vague, or you don't really understand it, you know, I think that they should know their viewpoint. Not that they can't change and incorporate things from other kinds of therapy, obviously, but really knowing what's important to them.
Oh, beautiful. I to amplify your very important point. I think there is, when my friends are looking for therapists, sometimes there is this, I don't know, myth that, well, I talked to this person and they seemed fine-ish. And what I always say is either, I mean, I use the example of my partner who talked to 8 therapists before he found the right fit.
Uh-huh.
And a piece of that was that his first therapist was an exceptionally trained. It was a beautiful fit. So he had a better sense of, I know what this can be.
Mm-hmm.
So I know when this doesn't feel right.
Mm-hmm.
And what I will sometimes say to people is, you don't marry the first person you date, right? Like, why would we commit such financial, emotional, and time resources
Mm-hmm.
to the first person that popped up on Psychology Today, right?
Mm-hmm. Mm-hmm.
And of course, I mean, there's good for anyone out there who is not an expert in the clinical outcomes and therapist factors research.
Right.
There is good, solid evidence across multiple labs that common factors like your relationship with your therapist, your ability to trust them, your alliance, your fit, that all is as determinant of your outcome as the modality that the therapist is using, like
Mm-hmm.
the theoretical orientation.
Yeah.
So it just, like, can you trust the person that you're talking to, right?
Absolutely.
Do you believe that they can be helpful?
Mm-hmm.
It doesn't mean it's always going to feel good, right? Like,
Right.
super uncomfortable.
Mm-hmm. It reminds me of one client that I was working with, and he said something along the lines of, Hope, I've never had therapy where I really, really enjoy having a conversation and exploring things. And also I'm like so highly like uncomfortable while I'm doing it, but I want to come back because I know something is happening and I know that I'm learning and growing. And I'm like, yes, that's it. That's it.
Totally.
Mm-hmm.
It's like it's sometimes like a good physical workout, right? Like
You
do
might feel
sore
tired afterwards.
Exactly.
Little nappy nap. Just
Yeah.
a little
Exactly.
siesta. That's why we have couches, right?
Exactly. Well, I just want to say a huge thank you. Thank you for spending some time talking with me. And it's funny, I want to say us, like the humanity us, the internet us.
Yes, yes.
And how can people find you, follow you, get more information?
So my website is radically open. No, actually, excuse me. It's actually rodbtdenver.com. And my Instagram is rodbtdenver as well. If you want to know more about RODBT, radicallyopen.net is a wonderful international resource. I'm a trainer as well for their organization, doing like one-day programs and some other work as well. And we're hoping to continue to have books and things that are coming down the pipeline that are more like lay person books that you can learn more and grow in. And the manual is out as of last year. So that's really exciting. Yeah.
Yay.
Yay.
Awesome. All right. Thanks so much, Hope.
Bye.